Hello everyone, I'm Thomas, and today I will be present on how health economics and market forces can actually shape healthcare delivery in public health education. So we're going to be examining how market mechanics operate in health systems. We are also going to evaluate how economic incentives drive health education and review quantitative data on preventing return on investment. So let's talk first about the market. In traditional markets, supply and demand dictate prices through customer choice and provider competition. However, healthcare is subject to unique market failures, specifically information asymmetry and highly inelastic demand. So patients cannot simply shop around during a medical emergency. A prime real world example is pharmaceutical pricing. Patents usually monopolize grand drug manufacturers' pricing power, driving life-saving medications out of financial reach for uninsured and low-income populations, thereby deepening existing health disparities. And it is indeed, isn't it? So, economic incentives profoundly shape public health education because while traditional fee-for-service payment models incentivize healthcare providers to focus on high-volume curative procedures rather than an actual prevention. So, in contrast, value-based care models such as CMS value-based purchasing reward providers for patient health outcomes and also like creating a strong financial incentive to invest in chronic disease education. Furthermore, programs like reciprocity health therapy demonstrate how the direct financial incentives for patients increase health care utilization and retention in preventive management programs. Now, the expenditure versus prevention ROI. So, to visualize these economic dynamics, consider national health expenditure data. Despite evidence showing that every dollar invested in community based preventive health education yields around 5.60 in prevented long term healthcare costs, so public health funding receives less than 5% of total healthcare budgets, which is totally crazy, and this stark contrast highlights the critical economic need to actually like realign fiscal incentives toward proactive health education and also early interventions, which is very important. Now, in conclusion, like we can say that market forces and economic structures dictate how healthcare is accessed and delivered. Aligning provider and patient incentives toward preventing care is essential for building sustainable and also equitable health systems. So, thank you so much.